So, what about the QME, the Qualified Medical Evaluation, is relevant to you? Well, let's talk about some of the factors that you may have to have addressed. And depending on what the dispute is, because a Qualified Medical Evaluation is when you have chosen to have a special evaluation by a specialist like an acupuncture specialist like myself, in order to look at and examine and then come up with conclusions about particular disputed issues. So one of those issues in the QME evaluation might be future medical treatment. Now, what is future medical treatment? Well, if you have reached a plateau where you have had medical treatment and you have been at about the same level for maybe 1 to 3 months, maybe even 6 months, and maybe you get a little worse, you get a little better, get a little worse, but it's basically about the same. That is when you are considered to be at permanent and stationary, or a stationary level of the condition. Now, permanent and stationary requires also that you have residual still, that you are not back to your pre-injury status. So if you're at permanent and stationary and not at your pre-injury status, it may be that you will need treatment in the future. That is what future medical treatment is about. So that would be one of the issues that might have to be looked at and made a determination on, as far as what do I anticipate, based on my 35 years of clinical experience with injured workers, what future medical treatment you might require. So that could be one of the issues that has to be addressed, or perhaps it is the only issue in your QME exam.